Another question, which I think a lot of people will have asked at some stage, is why do I sometimes feel tired despite all my thyroid levels being normal? If somebody asked you that, if it came to clinic, let's say it was a teenager came to clinic and said, Doc, Claire, why is it I still feel shattered, but you've told me today my thyroid hormone levels are fine?
We get that a lot, don't we? I think we get a lot of GPs asking for advice in between appointments and things, don't we, about people who are, in the thyroid clinic. And I think the difficult thing is that, the thyroid gland controls so many different systems that there can be so many potential signs and symptoms, can't there, when you look on, websites or the information that we give out and things, that it can be responsible for pretty much anything you can feel. But I think the important thing to remember here is that if your thyroid hormone levels are normal, then the chances are it's probably not your thyroid that's causing you to feel tired and unwell. And often we end up doing other blood tests and things and asking, doing other clinical examination, asking other questions to try and get to the bottom of what's going on, because it is unlikely to be your thyroid. Particularly in, for example, a teenage girl, we'd always want to ask, about their diet, about, exercise levels, anything else going on, their periods, are they anemic? Lots and lots of different causes of these things, which can be quite tricky to unpick. But I think, not saying that we get it perfect all the time with our thyroid medication, but if somebody's taking their medication and their levels are okay, I think it probably would be a signal to start looking elsewhere for those signs and symptoms. Do you think that's fair?
I think that's fair. And I suppose once or twice you come across late night Xbox sessions until 3 a.m, don't you? And so sometimes I guess it's just inquiring, I suppose, about people's sleep pattern.
Yeah.
Where they're getting can be as simple as that sometimes, can't it?
Whether something else is going on at home, at school, all these different aspects, yeah.
There's a question here about transition, and I guess there are 3 questions actually, but they kind of link together. At what age will my care move from my local hospital to the GP? How can I best prepare for the transfer of care? What care can I expect from the GP? I was thinking that it's a little bit tricky, this one, isn't it? Because I know that you and I see a lot of primary healthcare teams. Well, I guess it's fair to say they're under a lot of pressure, as are hospitals. But what do you think about that transition? Any particular thoughts?
I think it very much depends on what thyroid condition you've got as well. For example, you run the teenage clinic here in Newcastle, don't you? But you would still see a lot of the Graves patients in that clinic as a sort of a transition service, because those ones can still be, needing quite intensive treatment changes and things, can't they? So that wouldn't be appropriate to go back to the GP. But somebody who's, finished growing, has been on a regular dose of, levothyroxine for congenital hypothyroidism, something, and their dose hasn't changed since they've been 13 or 14, I would say that by the time they're, 16, 17, they're more than ready, and they're probably sick of us seeing us. They come into clinic every single time. We say, how are you? We're still fine. And, they don't want to trek to the hospital. So for them, moving to the GP, can't come too soon. And I think the key things I always try and prepare somebody for transition is, they need to take ownership of their condition. And I often say, you need your bloods checked, once a year, for example, for hypothyroidism. Try and time it around something that you can remember. So, treat yourself to a birthday present, go and get your bloods checked at the GP or something, and, just do it as a sort of routine thing. The only other thing, obviously, to point out here is, with pregnancy and young women, it's a bit awkward and embarrassing for the young people, but the parents tend to take it on board more, I think, because it's so far from the young person's mind at that point. But just a reminder that, in 10, 15 years' time, it will be high on their agenda, and to remember to take ownership and get their thyroid checked early in pregnancy as well. So I think those are the sort of 2 key tips I sort of talk about for transition, just taking ownership and, thinking ahead to the future to try and remember what information we gave them 15 years back.
I in my opinion, I think you've hit the nail on the head, really, and which is that in the olden days, I think there was a certain acceptance that the health service would contact you, but in 2024, I think there has to be some shared responsibility.
Definitely.
And I know it's in some respects you could argue it's a bit of a shame that people don't get chased in the same kind of way, but I think things are less likely to get missed if it's a young person and their family working with a family doctor, with primary care, rather than just the primary healthcare team being expected to make the call every year, time for your thyroid function test.
And it's difficult when young people move as well. They go to different GPs with university and moving all over the place. So I do think, in this day and age, the system has changed and people do need to take ownership. And I quite often spend a large part of a clinic appointment, talking about that. I think it is important.
Under what circumstances do you think it's appropriate for someone to have more time during their exams, as a general rule?
Yeah, I think it is a really hard question to answer, because undoubtedly some people are more affected, aren't they, by fluctuating hormone levels than others. But to me, it's only fair if those people should have extra time and allowances, because potentially if they didn't have those changes in their thyroid hormone levels, they might not need that extra time. So it's really important that we're supportive, but at the same time, lots of people have very well controlled thyroid hormone levels and actually probably don't need that extra time. So again, it's one of these cases where it's on an individual level, isn't it? And I think the advantage that we have and where we're very privileged is we build up a relationship with our patients, don't we? A lot of these patients we see every 4 or 6 months for many years, and so the families are able to explain to us whether there are struggles or not. And so I think we'd be able to pinpoint the ones that we did think needed special dispensation, letters to school. I don't think it's just yes, you've got thyrotoxicosis, you need a letter, for example. But I think it's on a more individual level, isn't it?
When it comes to school performance, I think, or the impact of thyroid on your performance in the exam, whether you should have extra time, I think if you've been diagnosed relatively close to a set of exams, I think it's very likely that your ability to focus, concentrate will have been affected to a greater or lesser extent, and getting extra time is entirely reasonable. But I suppose most of the young people with thyroid problems that I personally see, they once they're stable on their therapy, they're able to, in the vast majority of instances, concentrate in the same way as their peers. And so what they don't do is come to me saying, can I have a letter? Because they're thinking to themselves, well, I'm fine. I'm on the right medicine. My thyroid function tests are fine. Why should I have extra time given that my thyroid hormone levels are fine? My thyroid problem has been sorted. But as I say, I can certainly remember some young people who sadly have been really out of sorts for some considerable length of time leading up to exams. And in those circumstances, I think getting extra time and making sure those involved in the young person's education are aware of the background is so important.
Yeah, absolutely. Making school aware with plenty of as much notice as you can of the diagnosis is really important as well.
Yes.
Because the school teachers see them so regularly that they're often the ones who'll be able to pick up these things and flag them as well, aren't they?
Yes, that's quite so.